It's pretty simple. The patient will take their medication typically from cycle days 3 through 7, and then they'll come in, see either the nurse or the doctor for their mid-cycle ultrasound anywhere between days 12 and 14, and then they're given instructions where to go from there, as far as would it be timed intercourse. If it's an insemination, then they'll come back and see us within the next day or two for that.
One of our procedures that we do here is just what we call an ovulation or an OI, ovulation induction cycle, or an OI cycle. With that, the patient will be taking medications which we teach you how to give. They're given subcutaneously or into the fatty tissue, and they're given once a day, usually for about 5 or 6 days. We do an ultrasound prior to starting just to make sure that the ovaries are normal and that they are ready to be stimulated with these medications. After 5 days of the medication, we do another ultrasound. We do some lab work also, and basically what we're looking at is how many follicles or eggs is the patient developing. What size are they? How do they look? Does the patient need more medication? Is the patient ready to trigger ovulation? And so that's the different things that we do in looking at that cycle. Our goal is, depending on patient age, to get 1, 2, or 3 nice looking eggs.
The patients that are coming through IVF, I do giving them the initial consult. So I talk with them one-on-one, do about an hour-long consult, explain what testing we need, what type of medications, how to do their medications, and then also what to expect for the actual procedure.
For the retrievals, the patients will be on medications for about a month, and they'll have to come in for frequent ultrasounds and monitoring just to see how they're responding to their medications, and have quite a few ultrasounds and get their blood drawn, which they'll see me when they get their blood drawn, and then they have the retrieval.
And then, their husbands would give their specimen, and there's a couple different ways we can fertilize an egg, but we just get them to create embryos, and hopefully with some good embryos just implant them back and try to achieve a pregnancy. So it's kind of, if there's a tubal factor or a male factor, that's a lot of the reasons why we do IVF. Or just they might need a little bit more stimulation on their ovaries if their ovaries don't work as good as maybe if they're a little older client, patient. But it's amazing. Our lab is just top notch, and I've seen them do, really good stuff with maybe not such good stuff to work with, and it just makes me very proud to work here.